Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Spring is here, the leaves are out, the flowers are in bloom, and the ticks have returned. Tonight we take a look at how to prevent tick bites and what to do if you do get bit. This is tick season, so what should people be looking out for?
The most common thing that they're going to potentially get an illness from are ticks, the deer ticks. And I think everybody now is pretty familiar with Lyme disease, which is the most common tick-borne illness that we see here in the summer. The ticks can feed from any part of the body, but they tend to like the dark, hidden areas and potentially the moist areas as well. And also those are the areas that are easiest to miss.
When you find a tick on yourself or your child, what should you do?
If you find the tick embedded in your child, just pulling it out with tweezers, grabbing the tick as close to the head as you can get, as close to the skin as you can get, and pulling straight out. No twisting, no burning, no trying to suffocate with Vaseline.
Are pet owners more susceptible?
The pet can bring the ticks inside the house, and people who are pet owners, particularly dog owners, are out with their dogs. So taking precautions with applying the tick protective medication to the pet that the veterinarian prescribes is one way of preventing it.
What can people do to protect themselves?
The best way to protect ourselves from Lyme disease in particular is to prevent the tick bite and then prevent the tick from feeding for too long.
Do all tick bites exhibit the bullseye rash associated with Lyme disease?
Typically there will be a rash, but the difficulty is that we don't always see the rash. If the initial stage of Lyme disease is not treated, then a proportion of patients are at risk for going on for secondary or late complications of Lyme disease.